Hi, my name is Susan, and I'll be doing your assessment today. What brings you into my office?
Well, I need to get a physical examination so that I can be cleared to participate in intramural activities at Texas State University.
Oh, okay. You go to Texas State. What are you studying?
I'm studying biochemistry because I want to be a pharmacist.
Wow, that's great. Okay, well, do you have any reason to be concerned about today's assessment? Any area in which you feel, concerned?
Not, to a huge extent. I just have asthmatic tendencies, in which I typically experience some asthmatic symptoms while exercising that I thought, I should maybe get checked out before I delve into this sort of thing.
Okay. All right. Well, we'll take a listen and look and check everything out. Make sure you get cleared for athletic participation. I'm going to start with your vital signs. In future visits, we'll probably only get your blood pressure in one arm. Okay. Get your oxygen saturation with the other hand while we're doing that. And your temperature. Okay, 97.6. Is that about typical for you?
I believe so.
Okay. All right, you're running 98% oxygen saturation at this time, and your blood pressure looks really good, 114/69. These down really quick. Okay. All right. Take a look in your ears, nose, and throat, and then I'll look at your eyes. This is my otoscope. Let's see if you have any symptoms of inner ear infection. Your tympanic membrane looks really good, really normal. A little waxy buildup in there, but otherwise it's healthy. I'm just going to change out my cap on there. Let's take a look in your nostrils. You've been experiencing allergy symptoms?
Yep.
Yeah, your nasal mucosa is kind of a pale reddish color. Have you had any nasal discharge?
Yep.
It's a little more inflamed on your right. What color has the discharge been?
Yellow.
Okay, we'll just be sure to drink lots of water. I'm sure you know that.
Yeah.
Okay, let's see. In your mouth? Okay. Back of your throat looks good. Let's see. Stick out your tongue and say ah. Okay. I'm sorry. Raise your tongue and let me see underneath there. I don't see any ulceration or nodules. of any kind. Oral mucosa looks good. All right. Now I'm going to check your pupillary reflexes. Let's see. I'll turn off this light.
Sorry, it's bright.
Okay, good. Your pupils are equally reactive and round and responsive to light and accommodation. So next I'm going to look into your pupil and inspect the fundi, which is which I'm going to use the ophthalmoscope to take a look at. Okay. Can you cover your right eye, please? Thank you. Okay. Ocular fundus looks good. Now let's see the other eye, please. That's good. Sharp edges on your ocular fundus. All right. Sorry about that. Thank you.
Yep.
Okay. Let's see. I'm going to test your vestibulocochlear cranial nerve now with the whisper test. So you tell me repeat after me after I whisper into your ear.
13.
Good.
Baseball.
Great. So I don't guess too many concerts have done damage to your ears so far.
Not yet.
Okay. Let's see. Now I'm going to test some more of your. Well, I was going to test more of your cranial nerves, but I want to check your sinuses. So this is checking your maxillary sinuses. Does that feel tender? Is it okay? Does it hurt?
It's fine.
Okay. Okay. Good. And now I'm going to check your scalp for any lesions or nodules. Okay. Your hair has very good texture and shine. Oh, looks good. All right, now I'm going to palpate your lymph nodes. Well, I don't feel any enlargement. That's good. Oh, I guess your allergies are under control for now. Okay, I'm going to feel the posterior cervical chain of lymph nodes back here. No, I don't feel any swelling back there either. Over here. Okay, good. All right. Okay, lean your head back just a little bit. Okay, there's your cricoid cartilage. Do you have any, have you ever been diagnosed with any thyroid dysfunctions?
Yes, I used to experience hypothyroidism when I was around 11, but it hasn't resurfaced.
Oh, okay. Well, I don't feel any enlargement there. That's good. Can you gulp, take a swallow so I can check? Okay, that looks good. All right. I'm going to test some more of your cranial nerve functions. Shrug your shoulders for me. I don't know. Shrug them and keep them up. Okay, I'm going to push. All right, good resistance and strength. That's great. Now, push against my hand. I'm going to see your sternocleidomastoid muscle there. That looks good. Okay, push against this side. Okay, very good. Thank you. All right. Now I see your sternal notch there. So next I'm going to listen to your lungs. Just breathe normally. Okay, that sounds really good. I don't guess you've been experiencing any wheezing. Your lung sounds are really clear right now.
Good to hear.
Yeah. Okay, stand up for me. I want to check your lung expansion. So I'm just gonna, if you turn toward the wall, I'm gonna put my thumbs on either side of your spine back here, and I just want you to inhale and exhale as I hopefully will see my thumbs will spread apart. Okay?
Okay.
Go. Okay, that's good. Now, let's see. Let me listen to your lungs from the front.
Okay. Do you want me to sit back down?
This is fine. Good. Okay. All right. Go ahead and sit back down. Okay, let's do some cardiac assessment now, and you can, if you would, scoot back and put your head on the pillow, and I'm going to check your jugular venous pressure, which I'm sure for someone your age it's going to be completely within normal range. But it's something that we can monitor, over time throughout your life. So this will be a good baseline. Okay? So, let's see. This will be right here on your sternal notch. And I look for the oscillations of the interior jugular vein and measure the distance. It's good. It's about 1.5 centimeters. That's totally normal. Okay. Have you ever been told you have any kind of a irregular rhythm or murmur or anything like that?
No.
No? Okay. Let me listen to your heart sounds now. Good. sounds great. Good sinus rhythm, S1 and S2, with no added heart sounds. No friction rubs or murmurs either. Okay, well, this looks like a good place to check your bowel sounds. Oh. Checking in 4 quadrants. Okay. I'd say active bowel sounds in all 4 quadrants. All right. So then I'm going to percuss your abdomen, and then I can palpate to feel for any, abnormalities, and I'm sure that everything's going to be totally normal. So, liver should be right around here, which is indicated by the dullness of the percussion note. And that's more resonant there, which is normal because it's going to be over the stomach area. Okay. And over here is going to be your spleen, right under there. Okay. Did you eat recently? I see a little bit of peristaltic movement there.
I did.
Okay.
My mother fed me.
Good. Let's see. I'm sure you don't have any hepatic enlargement, but I'm just going to palpate now, and let me know if you feel any tenderness or pain.
It's a little uncomfortable, but no pain or tenderness.
Yeah. Okay. All right. Thank you. And can't usually, on someone your age especially, feel the spleen, but sometimes it helps if you turn into a lateral decubitus position, which is just a little bit onto your left side. Yeah, that's it. It helps the spleen, by gravity to get into a position where I might be able to feel it. Well, I didn't expect I'd be able to. Okay, we can lie flat again. See if there's any, if you have any kidney tenderness. Does that hurt?
No.
Okay, good. How about that? Great. Okay. Very good. Thank you.
Yep.
All right. I'll test your reflexes and musculoskeletal system motor functions kind of in one lump sum. So if you could just raise up your leg for me. Yeah. Now lay this one flat. Okay. That's good. Okay. Bring your toes toward you. And now flex, point. Let's see. Now flex your foot with your toes toward you. Now point your foot. Okay. And let's see. Bring this knee up. Okay. And down. All right. And check your joints for any swelling or asymmetry. Have you ever had any sports injuries, like a knee injury, or broken your ankle or broken any bones?
I haven't broke anything. Sprained my wrist one time, but that's about it.
Okay.
This knee is ruined for life.
Why? What happened?
Gymnastics, that's too hard.
Oh, okay.
Can't put weight on it, but that's it.
Okay. Yeah. Well, I don't see any, visible signs of swelling. Does it ever ache or hurt? Just.
Yeah, if I put weight on it, it's like extremely painful.
Oh. So.
So if I'm like on my knees.
Oh, okay, okay. But if you're running or just walking, it's okay. Okay. All right. Good. Okay. So if you put your foot this way, then I can check your ankle reflex with your Achilles tendon here. That's good. All right. And if you could straighten this leg out and put your leg over. I can test this one as well on the Achilles tendon. It's good. Okay. Now, if you could sit at the end, at the edge of the bed, then I can check your
patellar reflex.
Yes, your knee reflex with your patellar tendon. I know you're a pre-pharmacy student. Okay. Woo. All right, great. Okay. Now for your the triceps reflex. Okay. Thank you. Okay, super. All right. Let's see. For some of the other, normal cranial nerve functions, I want to make sure that you have a normal response. So, without looking, can you tell me if this is sharp or soft?
Sharp. Sharp. Soft.
Okay. Good. All right. Let's see. I need to check your pulses. Make sure that your circulation is normal. Okay, this is going to be your radial pulse and your brachial pulse and your ulnar pulse. Okay, now this side. That's your radial pulse, ulnar, and brachial. Okay. Yep, they feel the same on both sides. And I'm going to check your carotid pulse too. Okay, that's good. Okay, super. Now stand up, and we need to check your visual acuity with the Snellen eye chart. So we're going to take a step. We're going to step out here, and if you stand right about here, just read the chart for me until you can't read it anymore.
Okay, line 1 is E, line 2 is FP, line 3 is TOZ, line 4 is LPED, line 5 is PECFD, line 6 is EDFCZP, line 7 is FELOPZD, line 8 is something EF, POT, Oh, maybe on
Okay.
a 9. I can't read it at all.
Okay. All right. That's fine. That's good. You have good vision. All right. Now when we go back in here, I would like to observe your gait and stance.
Okay.
First, just stand there and close your eyes. Good. Okay, now you can open them. That was the Romberg test. No pronator drift. All right, now just walk from here to the end of the bed and then turn around. Okay. Now walk to the wall on your heels. Okay, good. Now turn around and walk to the end of the bed on your tiptoes. Okay, that's great. All right. I'd like to check your spine, your vertebrae now. I should probably start from up here. Have you ever had any back problems?
I don't think so.
No tenderness along the way here?
Mm-mm.
Okay. All right. Now lean forward. I want to check for scoliosis. Like you're going to touch your toes. Okay. It's nice and straight. I don't see any visible signs of abnormal curvature, so that's good. Well, Sarah, thank you very much for your patience with me, and I think that you have passed your physical assessment with flying colors, so you'll be cleared for athletics.
Great, thank you. Nice to meet you.
Thank you. You too. Have a good day.
All right.